mood swings, fatigue, problems with sleeping at night and focusing during the day, weight gain, and the list can go on. Many of us might dismiss these symptoms as a result of living a stressful lifestyle or perhaps just getting older. But is your body trying to send you an urgent message? Well, January is Thyroid Awareness Month, and joining us today here to discuss these signals are Dr. Jeffrey Garber, speaking on behalf of the American Association for Clinical Endocrinologists, and also Ronni Hochman, who suffers from hypothyroidism and is a patient of Dr. Garber's. Good morning to you both.
Good morning.
Good morning.
Good morning. So, Dr. Garber, let's first get started. Can you give us an idea of exactly what the thyroid does?
Well, first off, it's a small gland that's situated at the base of the neck, and it influences the way our body produces energy and how every cell, tissue, and organ in our system works. If you don't have enough thyroid hormone, things slow down. It's known as hypothyroidism or an underactive thyroid. If you have too much thyroid hormone, things speed up. It's known as hyperthyroidism or a hyperactive gland. In the event that you have hypothyroidism, you may feel sluggish, need more sleep, have an inability to concentrate, feel cold when other people feel comfortable, have slowed down bowels and dry skin. And for more information, one should go to thyroidawareness.com to explain these symptoms in more detail and give you other symptoms of hypothyroidism and hyperthyroidism.
Okay. So, Ms. Hochman, you actually suffer from hypothyroidism, which is the underactive thyroid.
Correct.
So how did you figure out that something was going wrong? What prompted you to see Dr. Garber?
Well, it was a process of elimination that started first with my general practitioner. I was suffering from many of the symptoms that Dr. Garber just suggested, fatigue, headaches, achiness, issues with my stomach. I was cold all the time. I just had a lot of symptoms that just were not normal. And I underwent a couple of tests. Through the process of elimination, we were able to determine that I was indeed had low levels of thyroid. But I would urge people to check with their family history, because the procedures that I had, one was a colonoscopy, and that came back negative, and one was a lactose intolerance testing, which also came back negative. But I did find out after my simple blood test that my mother had thyroid disease. She was hypothyroid, so all of that could have been eliminated. So it's important to know what your symptoms are, know what your family history is, and pursue that before you have to undergo some of the procedures I had to.
So you underwent those procedures because you were having stomach issues?
Headaches, stomach. Well, again, the lactose intolerance easily would have been the dairy, keeping me away from dairy. And the colonoscopy was just something they determined maybe I'd need to have. I don't know I think there was an iron deficiency. Again, I think it was just a process of elimination, but that's why it's so much more important that people be aware that the thyroid really does control so many, all our systems, right?
Right.
And when it's out of whack, your body's going to be out of whack. And it's a simple pill that I take once a day. I've had this for 20 years, and there's no impact on my life that's negative anymore. It's all, my body is in balance.
Good. I'm glad you were able to find that balance back. So, Dr. Garber, what is the process of elimination, I guess, that you use to diagnose a thyroid disorder?
I think you can start with it and eliminate it by just checking a simple blood test, which diagnoses hypothyroidism in the vast, vast majority of folks. Had that been done, Ronni would have avoided not only unpleasant tests, but potentially dangerous ones. A colonoscopy done on somebody with an underactive thyroid involves sedation. People with an underactive thyroid is profoundly severe. Hers may be exquisitely sensitive to sedation, and it could have led to a host of other problems. So having your antenna up, being aware, particularly about your risk, and in her case, and that and many others, of family history, engage your doctor, ask the question, get it out of the way before pursuing other avenues that are not just unpleasant, but come with a price at times to pay for going those testing, that kind of testing.
So the blood test that you're mentioning, is that the thyroid stimulating hormone test?
Exactly, otherwise known as a TSH.
Okay. And why is it that this condition so often goes undiagnosed or gets misdiagnosed as something else?
Well, we can get back to Ronnie's case in a moment, but generally speaking, the symptoms are not specific. Who doesn't have occasional fatigue? Who in today's day and age doesn't have a poor night's sleep here and again? Who
Right.
and who in New England doesn't complain of dry skin? So I think the issue is it different as it progressed and what is going on there? And then once the thyroid becomes underactive, you can have a chain of events that can lead to its masquerade. So you can have heavy periods, which could lead to iron deficiency. Combine that with constipation, or namely a change in bowel habit, and you can see why her doctors were concerned and did a colonoscopy. So you can go
Right.
down a diagnostic pathway based on a set of connected events that aren't obvious from the get-go.
So once she was diagnosed as having an underactive thyroid or hypothyroidism, can you explain what some of the treatment options are for that,
Well,
for someone that has issues?
For those with profound hypothyroidism, as she had, as opposed to those with the only slightest, mildest, that may in fact stay the same, not be symptomatic or get better, a single pill once a day, known as thyroxine or levothyroxine, taken before meals on a consistent basis is sufficient. There'd be some dose tweaking and eventually, for the vast majority of people, stabilization and being checked as infrequently as once a year. And more details again at thyroidawareness.com.
So that seems to be a relatively simple fix for something that can cause so many symptoms and cause so many different fluctuations in our body. That's good to know.
Absolutely.
Okay, so you recommend that if people are experiencing one or more of these symptoms to just, bring it up to their family doctor. Doc, is it possible that this could be thyroid related? Can I be checked to see if I have any thyroid issues going on?
That's exactly our message.
Okay. And can you give me the website one more time?
Thyroid Awareness is one word, and thyroid is THYROID, thyroidawareness.com.
Okay, well, thank you so much. This was very informative. Thank you both, Dr. Garber and Ms. Hochman.
Thank you.
Thank you.